Good morning, dear student. In today's lecture, we will discuss some of the radioactive nuclei which is used in pharmaceuticals. So let us discuss the first, that is iodine 131. So this iodine 131, so generally the sodium iodide, it is used as a radioactive nuclei. So if we discuss some chemistry regarding to this 131 iodine, then the number of neutron in this 131 iodine, the number of neutron in 131 iodine is 78. Number of neutron is 78. Then number of protons, number of proton is 53. Again, if you find out its T1 half, its T1 half, it is 8 days. T1 half, it is 8 days. If you consider, it is beta minus emitter, or we can say that it is beta emitter and gamma emitter. This 131 iodine, number of neutron is 78, number of proton is 53, T1 half is 8 day, it is beta emitter and it is also a gamma emitter. So we already discussed what is this beta emissions. So whenever there is a beta emission, the electrons are removed and the neutron is converted into protons. So if you consider 131 iodine 53 atomic number, when it undergo beta minus decay, then it will convert into xenon 131 having atomic number 54 with emission of this beta minus particle. Beta minus particle means the emission of electrons and some small energy particles such as neutrino. It is not a pure beta emitter, it also emits some gamma radiation. So you should remember this point, that is it is beta emitter and it is also a gamma emitter. Whenever there is a beta emission, the conversion of neutron to proton, so the conversion of neutron to proton, so you should remember the conversion of neutron to proton. Again, if you consider its used, so it is generally used in to treat the thyroid cancer. It is used to treat the thyroid cancer. So the cells, cancerous cells present in thyroids, so they are used. See, this 131 iodine, it is used to treat thyroid cancer. So let us discuss some important points regarding to this 131 iodine. So you should remember, it is a not pure beta emitter, it emits beta radiation as well as the gamma radiation. Again, if you consider, it is used to treat the thyroid cancer, it is used to treat the thyroid cancers. And then again, the next important points regarding to this 131 iodine is that the route of administration, the route of administration, so there are different routes of administration, that is inhalation, ingestion, contact with skin and bodies. So route of administration, the route of administration, it is orally, it is taken orally. So it is administer, it is administered as a sodium salt, sodium salt of 131 iodine of iodine 131 orally. So the route of administration, it is administered orally. So this is the points. If you consider, it collects in thyroid cell. If you consider the mechanism of working, it collects in thyroid cell where the radiation can destroy the thyroid glands and other thyroid cells such as cancerous cells. So if you consider its some advantages of this iodine 131, so if you consider the advantages of this iodine 131, it is simple, it is simple and inexpensive. It is simple and inexpensive. Again, if you consider no surgical risk or injury, so no uh, risk or injury to parathyroids, to parathyroids. So we are not goes into details what is this hyperthyroids, hypothyroids, parathyroids. So you should this is for your home assignment. You should find out what is thyroid, what is thyroid glands, what is the different types of what is different types of thyroids such as hyperthyroids, hypothyroids, what is parathyroids. So you should find out this. We only interested the use of this 131 iodine, that is it is used to treat the thyroid cells, to treat the cancerous cells, that is thyroid cancers. Again, no surgical risk or injury to parathyroids. Again, if you consider its another advantage is that it control hyperthyroidism permanently. It control hyperthyroidism, hyperthyroidism permanently, hyperthyroidism permanently. So these are the some advantages. If you consider its disadvantages, it cannot used. So let us see some disadvantages. It cannot used in pregnancy. So we cannot used in pregnancy. Again, it is not suitable for young patient. The second advantage is that it is not suitable for young patient. It is not suitable for young patients. So these are the important points you should remember. So you should remember what is 131 iodine, what are its T1 half, what are its uses, what are the route of administration, and the route of administration, and what are its advantages, disadvantages, and for which treatment it is used. So this is all about 131 iodine. So its T1 half is only 8 day. The route of administration, you should remember, a route of administration, it is taken orally. Then third, it is used to treat the thyroid cancer. It is some advantages, it is simple, inexpensive, uh, no risk or injury to the parathyroids, control hyperthyroidism permanently, but it cannot be used in pregnancy. So it has a certain disadvantages, it cannot use in pregnancy, and it is not useful for young patients. So this is regarding to the 131 iodine. Let us discuss some important points regarding to the strontium 89. Let us discuss some important points regarding to the strontium 89. The strontium 89, it is used as a strontium chloride. Again, if you consider this strontium 89, it is a pure beta emitter. So you should remember, it is pure beta emitter. Again, if you consider the number of proton in this strontium 89, it is 78. The number of proton, if you consider the number of proton is 38, and the number of neutron is 51. So these points are not very important, but you should remember the first point, that is, it is pure beta emitter. That is, when it emits beta particles, that is strontium 89 having atomic number 38, when it emits beta particles, that is emission of electron, then it convert into yttrium 89, and the atomic number it is increases by 1 unit with emission of beta minus particle, and with small amount of neutrino, low energy particle, that is neutrino. So in this case also the conversion of neutron to protons. So here the neutron to proton conversion, it is pure beta emitter. And then if you consider uh, its route of administration, so you should remember this, the route of administration, the route of administration, it is taken intravenously, intravenously. So you should remember it is pure beta emitter. Then the route of administration, it is intravenously, it administer intravenously. Again, if you find out, it's T1 half, and then it is 50.57 days. So it has a longer T1 half as compared to 131 iodine. And then it is used, what is it used, it used used to help, we can say that it is used to relieve the bone pain. It is used to relieve the bone pain. So generally it is used to treat the bone cancer. It is used to treat the bone cancer. Again, the length of the treatment, it will depends on the type of the drugs you are taking and how your body respond to them. So again, it is used to treat the bone cancer. So it is used to treat the different types of bone pain. So this is all about the 89 strontium. So you should remember it is a pure beta emitter. Again, its T1 half is 50.57 days. Then the route of administration, that is intravenous, the route of administration is intravenous, and it is used to treat the bone cancer. It is to relieve the pain, that is to relieve the bone pain. So let us discuss the next important radioactive nuclei which is used in pharmaceuticals, that is 153 samarium, 153 samarium, that is it is combined with this EDTMP. So what is this EDTMP? It is an analog of ethylene diamine tetraacetic acid. So in this case it is ethylene diamine tetra methylene phosphonic acid. So it is a phosphonic acid. So we can write this methylene phosphonic acid, methylene phosphonic acid. So it is the analog of EDT, methylene phosphonic acid. It will interact with this 153 samarium. Again, if you find out, it emits, so let us see one by one. It emits beta particle, it will emits beta particle as well as some gamma radiation. So it is not pure beta emitter as compared to 89 strontium. So it emits beta particle as well as gamma radiation, same as 131 iodine. Again, if you consider its T1 half, then it is 1.9 days, 1.9 days T1 half. Again, The route of administration, third important point, the route of administration, the route of administration is again intravenous, same as strontium 89. The route of administration, that is intravenous. Then if you consider it is used, what is its use, if you consider its use, that is it is used uh, in painful bone metastasis. So it is useful in painful bone metastasis. Again, we can consider bone metastasis. So what is this metastasis? So you should remember, uh, what is this bone metastasis? The spread of cancer cell from place where the first form, that is spreading of the cancer cell where they first form to another part of the body. It is known as metastasis. So this both strontium 89 and 153 samarium, it is used for the treatment of metastasis, that is the spreading of cancerous cells from place where they first form to another part of the body. So what's going on in this metastasis? That is the cancerous cells break away from the original tumor uh, and travel through the blood and forms new tumor in the organ or tissue of the body. So you should remember, so it is bone metastasis. So both these isotopes are very useful in case of bone cancer, that is bone metastasis, the spreading of cancerous cells from the place where they first form to another part of the body. So what is going on in this metastasis? The cancerous cells break away from the original tumor and travel through the blood and forms new tumor in the organ or tissue of the body. So these 153 samarium and strontium 89 are very useful. So this is regarding to the 153 samarium. So you should remember which radioisotopes is used in pharmaceuticals, what are their uses. So iodine 131, it is used for thyroid cancer, and the 89 strontium and 153 samarium, it is used to treat the bone metastasis, that is bone cancer. Again, you should remember either it is beta emitter, gamma emitter, or any type of emitter. So you should remember what kind of radiations they emit. Okay, then it's T1 half life, then the route of administration. So you should remember these 1 2 3 4 points, that is which radiation it emits, then it's T1 half, the route of administration, and what it's used. We are not very much interested regarding to the processes, what is thyroid, what are the different types of thyroid cells. So we are not very much interested in these points. So we are very much interested in only the use of these radioactive nuclides, because we are chemistry students. We are not very much interested in details, goes into details, because the weightage for this chapter is only 2 lectures. So we understand only that which are the radioactive nuclide, which are alpha emitters, alpha rays emitter, which are beta, which are gamma rays emitter, when there is emission. So what going on when the neutron is converted into proton, proton is converted into neutron. So you should remember this point, and the use of different radioactive isotopes. So in syllabus only these three are studied, but different isotopes are used, radioactive nuclei are used in pharmaceuticals. So we should remember, uh, the radioactive nuclei and it's used for further study. So this is all about the radioactive nuclide in pharmaceuticals. In next lecture we will discuss the remaining points, the remaining chapters of this section, that is CHI 332 section 6. Thank you.